Welcome back to another exciting episode of SMK's Compliance Minute. Today, I have the pleasure of bringing to you Leigh Ann Thomas, a registered nurse and an expert in the field of long-term care administration. Leigh Ann has joined SMK Medical, and she's here today to talk about her experience in long-term care, as well as talk to us just about the basic necessities that a DON must have to be successful. So without further ado, let me bring on Leigh Ann to the screen. Welcome, Leigh Ann.
Hi,
How you doing today?
I'm doing all right. How are you?
Hey, I am good. I appreciate you for taking time out of your day to speak with me today about your experience, your knowledge, and the role of an effective DON in long-term care.
I appreciate the opportunity.
Yeah, so I did a little bit of just introduction, but as I always tell people, it holds no candle to who you are. So tell us, who is Leigh Ann Thomas?
Well, she's a registered nurse, a mother of three, and just a busy person.
Understand.
That's about it.
So how long have you been working in the long-term care sector? You know, I know you've been a nurse for over 30 years, but have you always been in this sector?
Since 1996. On and off, I had about 3 or 4 years in the acute care setting,
Yeah.
but mostly I just said, nah. I found my world in long-term care.
And
Love
most
it.
of your time in long-term care, has it been at the director level or director of nursing, or have you held various roles?
I have had various roles. I spent the majority of my time in the MDS coordinator world or reimbursement. I did spend a few years as director of nursing. So there's that. Did some travel nursing.
Okay. So a wide variety of experiences, it sounds like, is under your belt. Because I imagine as a travel nurse, travel DON, travel MDS consultant, you're walking in the buildings and not knowing what to expect. Is that correct?
That's right. And they don't hire your travel nurse for MDS or DON unless they need you. So you can imagine most of the buildings, I'd say 98% were in a crisis mode. They had just been through a horrible survey. DONs walked out, administrators walked out, and they just needed somebody right away.
So when you're called, what is that call like? It's like, hey, the building's on fire, and you put on your cape and you fly in and save them. What is that like?
Oh, not quite that extreme. But
She's downplaying her skills as an expert. Please know that, because
yeah, it's I've had some really great experiences, lots of learning and education, mainly as far as approach, especially in environments with quite different cultures than I'm accustomed,
yeah.
and being able to walk into any situation and do the job and do it well. It's a challenge sometimes.
You know, you hit the nail on the head, right? Because as a travel nurse, as a travel DON, a travel consultant, you're walking into cultures, and the cultures are all over the place, right? How it's ran in New York is going to be different than Florida, than Arizona, to DC, to Hawaii. So, how do you walk into a new facility and assimilate into their culture and move the needle forward?
I think for myself personally, it's a day to day. First day really is just keeping your ears and eyes open and learning the culture and keeping your mouth shut, because oftentimes we communicate things quite differently in Wisconsin than we would in Hawaii
Yeah,
or
yeah.
Tennessee. I mean, and of course, everywhere I go, it seems that I have the accent. So there's always a challenge there. And I think it's just a matter of going in and knowing you're there to help,
Hmm.
and just to make sure the people you're helping understand that from the get-go.
Wow. And I think that's important, right? Because oftentimes SMK Medical is hired to come into facilities and help them post survey, help them with MDS consulting, help them with quality management. And one of the things that I speak when I'm speaking with the administrator or the director of nursing is, hey, I'm here to help you. I'm here to partner with you. I'm not one of the consultants going to just point out issues and walk out the door. Let's point out issues together and roll our sleeves up and move the needle forward. And it sounds like that's what you're saying you do.
Yes, Absolutely. And it takes those first few days just to get a feel for what actually needs to be done.
So, when a building, you mentioned they're calling you because they're in had a bad survey, maybe received an IJ or K or an L, but oftentimes they're calling you after the survey has happened, right? How can buildings proactively prepare for survey management?
Well, and that's a tough question. Mainly, it involves processes and systems that just need to be on a daily routine so that they can prepare now, today, and going
Hmm.
forward. And have someone, I like to say, watching the store on pretty much
I
every
like that.
system and process to make sure that it's up and running.
I like that. So elaborate a little bit more on watching the store, right? I use the term who's checking the checker, but I like the idea of watching the store. So from your perspective, what does that mean?
That means that as administrative team, IDT team, it's important for each member of the team in their particular department to have a routine plan for how to know what's going on a daily basis and how to be aware of problems before they become a problem, if that makes any
Yes.
sense.
You
So
know,
each department would have some tool or some routine that they go through to ensure, as the leader of that department, they understand what's going on and what needs to be fixed, what needs to be addressed. We could go down the line.
but
You understand what I'm saying?
but you're saying something that's important, right? You need to have a plan of what needs to be fixed and what needs to be addressed. But if I'm a new DON and stop me when I'm wrong, I was probably promoted because no one wanted the job, or someone I knew told me I could do the job, but I had no experience. How do I gain that knowledge and understanding that there is a problem because nobody trained me? How do I gain that knowledge?
Hopefully, you are able to have some resource. You would need a resource for sure. I know a lot of folks who don't have people like SMK
Hmm.
are searching the internet, are going to sites, are going to different places where sometimes the information may or may not be correct. Um, Oftentimes, as a new nurse myself, looking for information, I made the mistake sometimes of going to places where there was no real resource for that person educating me
Hmm.
on the computer or whatever. So it's kind of tricky.
It's interesting that you say that, because when we talk about resources and actually the resources that are out there, I don't think people know that there are certain resources out there. So as I tell people, if you're um, a DON, you're administrator, you're anything of that sort in a leadership position, there are resources out there, and there are people out there who want to assist and help. But even without naming companies, SMK Medical or as a healthcare consulting firm, CMS releases pathways, right? They releases their pathways, and you can use those pathways to check the checker or check the store. They're telling you this is what we're going to use, and this is what we're going to evaluate you on. Now, we all know, we've been through survey, that once they start digging, they're going to dig deeper, and they can deviate from the pathways. But oftentimes those pathways are a great resource and a great tool for you to start to evaluate your processes. If you're not cutting the mustard with the pathways and you're finding it yourself, imagine what a surveyor who has to train eagle eye is going to find. So you mentioned SMK Medical, and I'd like to show that to the audience now. So at SMK Medical, we are a full service healthcare consulting firm specializing in survey management, risk management, QAPI, MDS support, MDS completion, PDPM optimization, and so much more. And on our website, we have this little free tool section. This is the free tool section here. And when you come here, you can sign up for our free tools. Now, In our free tools section, once you sign up, you'll gain access to a host of information that we have behind the scenes that we call our free tools section. You'll gain access to our fillable forms, which we have physician certification in there, access to triple check validation, and you will also get access to the pathways that CMS have. We have them here for you. So it is of a great benefit for you to sign up for our free tools. So that way, if you are an independent facility, you don't have access, you don't know where to turn, you sign up with us and we will send you the free tools. And as we upload it, you'll get an email that, hey, SMK Medical has uploaded some additional free tools. So I think that for those small facilities and even large facilities, that's something that they may want to check into. So Leanne, you mentioned that you have done MDS. From your perspective, what is the role of an MDS coordinator?
Oh my. He is the fact checker,
Yes.
is an auditor, is the cashier.
Like that.
She or he really covers so many different pieces of the pie when it comes mainly to quality resident care and reimbursement. And it's a huge pie when it comes to all of the responsibilities of an MDS coordinator.
So, we had Glenda on another series, and we talked about the importance of MDS officers, MDS nurses remaining in their office, right? We talked about, and from a standpoint of not pulling the MDS nurse to the floor to work a card. From your perspective, what happens when an administrator, a director of nursing says, hey, we're short staff, I need to pull you to the card? How does that impact the facility?
Financially, quality of care is impacted. It's mainly to your MDS person in general and their particular job satisfaction, where they are in a time constraint. They are required to complete tasks according to CMS in a timely fashion. And when they're suddenly pulled away from that schedule, they're unable to complete their job duties, their primary job duties, which causes them dissatisfaction in the long run, especially if it's a repeated thing. It's hard to feel good about the job you're doing if you're not able to do your job. Does that make sense?
Yeah. Oh, I think you hit the nail on the head, right? Because I was hired to do one thing, and I understand in the event of an emergency. But what I've seen, being a
Right.
licensed nursing home administrator, being a director of nursing, is that oftentimes we say everything's an emergency. The building's on fire, and we got to pull you. And as I've, learned through SMK Medical, talking to experts like yourself, talking to experts such as Glenda, is that when I pull that MDS nurse off the floor, I effectively stopped revenue from coming in.
Correct.
If I had a new admission and we didn't open that assessment timely, well, now we have some issues, right?
Right.
If we had some authorizations that needed to be done and the nurse didn't do her part, we're talking about some financial implications. If we have some issues where we didn't get a physician certification timely, right? So all of that rolls
We have some
downhill.
survey impact.
Yes.
Yep.
So all that rolls downhill. So as you've gone through your career, right, your over 30-year career in nursing and in leadership, what are some of the issues you see MDS nurses make, or some of the issues or common mistakes MDS nurses make while they're coding or doing the MDS assessment?
I think coding is not as huge a problem as it was probably a couple of 3 years ago when we were getting used to PDPM and GG and all of those things. Coding may not be as big of an issue now as just following through. I think I see the mistakes more so with MDS coordinators in the form of communication or in the form of the care plans, as far as using that RAI process to its full extent, in that you've got this wonderful assessment tool which produces this wonderful assessment, again, for care
Mhm.
areas, which can create an amazing plan of care. And with all of that in place, you've got a really great system. But if we miss any little part of it, we end up losing out, survey wise, reimbursement wise.
And when you talk about survey wise, right, and reimbursement wise, the MDS nurse plays or MDS coordinator plays a vital role into that, right? So there's something that they have to have ready for the survey team when they walk in. What is that? What is that called again? And what is the role?
802-672.
Yeah.
I think most MDS coordinators would probably say it's the vein of their existence. But
But
actually,
why? Tell me why.
because it's one of those processes that is often broken in a facility where we either forget or we don't have a system, and the surveyor walks in and we haven't updated this in 3 months.
Wow.
So we're looking at a good amount of time to get an accurate 802.
What's interesting is the surveyors already know who's in your building and what's in your building. They're just checking you to make sure you got it correctly.
Right.
So, what is your recommendation for the team to keep that updated? Should they update it daily, weekly, monthly? What does that
I
look
think
like?
this would be dependent, I think, on the size of the building.
Okay.
Because, the larger the building, the more often you would need to update that, because you
Okay.
want to make it a time issue as well. It takes a little longer with a bigger building. And I think you would have someone assigned. That could be the MDS coordinator. It could also be a director of nursing. It could be a unit manager. It could be someone who's been educated on how to keep it up to date. And then it's a matter of just doing it routinely. It's part of your day. And as far as I'm concerned, there are a lot of processes that need to happen on a daily basis. And this is just one little piece of it. But in that particular hour-long meeting that I think clinical should be having, 30 minutes, depending on the census again, there's a review that goes on. You look over your progress notes. You look over your orders. You check the last 24 hours. You see what's changed. And then you update care plans. You update that 802-672, and you move on with your day, taking care of some residents or doing MDS assessments or completing pain interviews or whatever you need to do.
Wow. You mentioned a lot of the MDS role in their job responsibilities. And I think that some people don't understand the MDS's role and their responsibilities in driving clinical outcomes. So from your perspective, how does the MDS role or MDS coordinator impact clinical outcomes for the resident?
I would say definitely with care planning and making that care plan available to the staff, the nurses, the CNAs, and ensuring those CNAs and nurses are reviewing the plan of care
Mm-hmm.
so that those tasks are carried out and you have a quality of life for your residents.
So it sounds like you're saying care plan is a big portion of the MDS nurse's job. Is that what I'm gathering?
I agree. Yes,
So
absolutely.
what are care plans and how do we complete them at a high level, right? I know we're going to do a series on care planning, but what are care plans for the people in the back who, think they understand care plans, but it's I'm sure it's much different than what we learned in school. From a long-term care expert such as yourself, what is care plans and how do we do them?
A care plan is really, generally speaking, a list of all the problems or potential problems that this individual has. And it is completely resident center individualized. And you'll have this list, and then you'll have goals for that resident to help them with that problem. So you want to make sure that there's some kind of goal for them that they agree to, resident centered, that is measurable, that has a time frame, and they're able to work with the goal realistically and have that outcome of either improvement or maintenance. And we pretty much don't talk about decline, unless it's expected decline
Yes.
for our residents who might be terminal or whatever. And then there's a process by which we add interventions, which with each care plan to meet the goal
Okay.
realistically. And those interventions are where our staff come in to be sure that they are carrying out those tasks that help that resident meet the goal.
Okay. It's interesting. I know a little secret about you that I'm going to spill out.
Uh-oh.
In your 30 years, you've mentioned that you've never received a care plan tag.
That's correct.
How does that happen? Everywhere I go, I see care plan tag. You get a care plan tag. You get a care plan tag. You get a care plan tag. What is your secret? What are you doing that's ensuring care plan excellence?
I think I was really blessed early on. Back in '98, I took my first MDS full-time job,
Wow.
and I had a really great corporate nurse who came in and helped me. I had some experience, and I always said it was really crazy how my career started because I wanted to be in ICU or ER, adrenaline, want to be there. I
Yes.
ended up on a skilled facility floor, skilled unit,
Wow.
or I'd say it would be step down. It was kind of the first 21 days in between the hospital stay and the nursing home. So we would have our little hip fractures and our little strokes, and
Mm-hmm.
we'd take care of them until they went to the nursing home. And I was introduced to MDS there, all the while wishing I was in ICU or ER.
Wow.
And we filled them out with pencil and paper and mailed them to the state. That was back in the golden days. Anyway,
Wow.
yeah. So I would say that I'm trying to remember where I was going with that.
No, but
But
you hit something on the head, and I think for definitely, I know MDS is paper, but I didn't know you had to mail it to the state.
that was back in the early days before it was all computerized. Yeah, it's pretty
So
interesting.
yeah, that's definitely interesting. Once again, I had no idea. Obviously, I knew MDS 2.0, I know MDS 3.0, and I know it right as I came up. It's been in the computer system, or EMR or EHR as we call it. But to hear you say, you transitioned from paper, so I imagine that it was very daunting back then doing it on paper.
It was, and I came to love the puzzle because really it's a putting together of the resident.
Mm-hmm.
To be able to pull all of the information that MDS requests from your documentation, to be able to have those nurses on board to complete the documentation so that you can complete a thorough and accurate assessment. And from there, have a really great care plan.
And to your point, right? Care plans are important, and I know this as a nurse, but as an administrator, I don't know this. If you follow what I'm saying, I happen to be trained dually as a licensed nurse home administrator, licensed in multiple states, as well as a registered nurse licensed in multiple states as well. When I talk to my administrator counterpart friends, and I say, "Hey, what is your care plan process? How are you updating the care plan, managing your care plan process?" It's always, well, that's just something they do, and it's not, it's not what I saw as a LP and as a unit manager. We just go into a room and we just, all typing on the computer. Everybody takes a resident. That's not really care planning, because it's not the IDT team. Just because we met in the same room, if we're not having a conversation and a dialogue with therapy, speech, activities, I'm sure I'm leaving out other departments. I'm not the expert. You are the expert. But if we're not physically talking back and forth, we're not really having an IDT team meeting. We can say we are because we got together. But if everybody's taking their own resident and filling it out, what are we really doing?
Well, and two, it's not just the getting together, it's the participation. And I tell you, some of the best experiences I've had were those team members who were involved and
Yes.
present. And we, can talk about a fall intervention on someone who's had multiple falls. And we have a roadblock in that I do sometimes. What are we going to do for this person?
Yes.
And it could be the dietary manager who says, what about whatever. And to have that team involved and be able to have this open and honest conversation about how to help the resident and the focus be on the resident is amazing. It's happened, and it can happen anywhere.
You know what? And for the people in the back, it can happen anywhere. And that's where Leanne comes in, right? As an expert in care plan writing, development, training, and education, coupled with SMK's backing, we've partnered along to assist facilities across the U.S. with reviewing their care planning process, doing care plan audits for them, doing training and education. SMK Medical is now certified to provide CEUs to facilities as we provide that training and education to you. So if you're a long-term care administrator, a regional director of operational, or the regional director of operations, regional clinical directors, or owner, please reach out to SMK Medical. Our number is 313-314-8267, or you can visit our website at smkmed.com. We're here to help and here to support. You know, we understand the intricacies that every nursing home faces, right? I come with years of experience. Leanne comes with years of experience. And oftentimes we don't have the time to put into developing those care plans, updating that MDS, updating that 802, just because we're faced with a barrage of situations that's happening. Some are related to staffing, right? That's probably one of the biggest things, right? But also there's some issues with just various different surveys and how one surveyor wants it versus the next surveyor, right? I think we've all experienced that. Every surveyor wants something a little bit different. So having us come in from an objective perspective and providing some guidance and insight is definitely beneficial to your organization. So we invite you to reach out to us. We do offer a free MDS assessment to determine if your MDSs are where they need to be. And also just a quick glance over your care plans just to see if they are where they need to be. I think one of the things Leanne has found in her years of experience, and I know definitely partnering with SMK, is that these care plans are often just canned, right? They're often just click and insert. So talk to us about what you're finding as you're going through some of the care plans currently at a high level, right? What are you finding?
I think the main thing is that we're not meeting the CMS regulation. And I know you can go to, even the RAI manual lays it out pretty clear in chapter 4. And the main thing is individualized. Of course, that happened a few years ago where they determined that it was more effective to have a resident-centered approach. So when we go to care plans, even today, I'm still seeing that care plan would fit pretty much anybody in the building.
Wow.
And we don't even really know who we're talking about. And I think that's the real key, is you should be able to look at one plan of care. And if you know your residents, you should be able to see, oh, I know who that is.
Yep.
Just from reading the plan of care now, because it's so individualized. It should have interventions in it that include those resident preferences and those little idiosyncrasies, that every person has as far as their day-to-day.
Wow. Leanne, as we draw this to a close, what is one thing that facilities should know about care planning and maintaining their care plans and all things, as you would say, MDS related? What is one thing that they need to know?
I'd say that when it comes to survey, your MDS is the beginning, because oftentimes what comes from that flows out.
Yes.
If that makes sense. If we don't have that good care plan in place, we probably don't have good communication. We probably could have a little bit better care, and we could be a little bit better with our outcomes at survey.
Wow. Profound. And obviously we're getting ready to partner up to launch our care plan series, and we're going to definitely do more engagements like this. I'd love to host a webinar with you where it's Ask the Expert, Leanne, right? How can people...
I'm having a little trouble with the expert word, because I just want to put out to you and everybody, I'm still learning too. We're all learning. CMS changes everything every other day, and we're still keeping up,
that's the humbleness in her, right? That is the humbleness in it. So I'm gonna call a spade, right? This is somebody You're not going to tell me not an expert, and you have 30 years in long term care, and you haven't got a care plan tag. What
Yeah.
we're not going to do is take away from your successes that you've had over the course of your career, right? You've been hired by many facilities to come in and turn them around. They're not beating down the doors of people who are not experts in their field and know what they're doing. They're calling you for a reason, right? So while you may be humble, I'm a brag about it, right? Because what you're
All
doing is
right.
great. And ultimately, right, what you're doing is improving the clinical outcome for the patients. Because when we have the right care plan interventions, we can deliver the right care. If I'm delivering canned interventions, am I really delivering the right care?
Nope.
So, Leanne, I appreciate your time for you coming on to this quick podcast just to talk about uh, MDS care planning and your experience in long term care. I appreciate you, and to the audience viewing, thank you for watching this episode. We will definitely have plenty more episodes with Leanne talking about MDS care planning and all things related to healthcare compliance. If you don't know, once again, my name is Demetrius. I'm a registered nurse and licensed nurse home administrator with smkmedical.com. We focus on MDS support, pre and post survey support, mock surveys, QAPI management, and EMR training. If you have any questions, you can reach out to me directly at 313-314-8267 or visit our website at smkmed.com.